Initial technical assessments with ground-penetrating radar has identified anomalies that require further investigation.
And with that, Wednesday morning's announcement from the Saskatchewan Health Authority and provincial government went from what's next for this potential parkade to what is in the ground. Hospital staff have been asking for more parking for years, citing both safety concerns and availability. The parking lot was established in 1975. Prior to that, it was green space, and before that, well, history is murky. The first cottage hospital was opened on the RGH grounds in 1895. There was also a children's aid home in the vicinity. According to the City of Regina archives, construction of the Regina General Hospital as we know it began in 1909 and was completed 2 years later. The building had several additions in 1913 and 1927, with more to follow in 1949, 1966, and the late 1990s. That means there could be a number of possibilities.
Old foundations, old excavation work could be burial sites. That's why we're proceeding with the excavation work as next steps and seeing what the actual anomalies are.
We have buildings showing up in the 1913 fire insurance plans, and then our next evidence of what the site looks like is from the first adequate aerial photography, which is from 1947.
The 34-year gap means crews need to excavate here in the northwest corner of the lot around 13th Avenue and St. John Street. The SHA says it's working with the City of Regina to try to find solutions for the temporary parking reduction. Fences will go up soon, and exploratory work is expected to take about a month. In the event that any human remains are discovered, the SHA and provincial government say they will work closely with partners on next steps. Morissette says they will also share anything of historical significance. The government insists the excavation will not stall the parkade's construction. The archaeological assessment, including on-site excavation, is included in the $750,000 budgeted this year for the parkade plan. The northwest corner was the only area that found anomalies.
We reviewed the entire parking lot of the entire hospital so that we have site options throughout it. So we're just going to continue down that path, making sure that we're in place to start procurement and then, of course, construction.
As for the timeline for actual construction shovels in the ground, that information is still to come. Sam McKegg, CBC News, Regina.